go down this rabbit hole for a long time, but I think the point I'm trying to make is this stuff gets complicated, and you need the right you need the right people on the bus to do this stuff, because it just, I mean, I don't care how smart you are, you need a team of people that know what the heck they're doing. And then this links to, and typically, if you're going to involve lawyers, which you ultimately will have to do, it's been my experience that you're pretty much going to have to involve people that have domain expertise, just like medicine. I mean, you can't hire a neurosurgeon to do primary care. So you have to hire people that are kind of specialized in what they do. So that typically means entity formation and governance. Do you create an LLC? Do you create an S Corp? Do you create a C Corp? How do you run it? How do you stage the board? Blah, blah, blah. Number two, you need an intellectual property lawyer. Number three, you need a securities lawyer, because you're raising private money and there's lots and lots of laws and things you can do and can't do to understand that process. And then typically you're going to need some sort of business law person that understands contracts and negotiations and sort of operations and all that other business. Now, every one of those comes with a price tag. And so people are probably listening to this and saying, wait a minute, where do I find the money to hire these folks? And when do I do that? And so what's the answer to that question? Like you sort of walked us a little bit through fundraising.
Yeah.
And maybe you can tell us, so where are you now in terms of raising money, and what do you need in the future, and how are you going to get it?
So yeah, so all that, everything that you described is very accurate, and it is an expensive and time-consuming process. And then yes, you do have to find the money to be able to finance all the aspects of it. Like I said, we were self-funded to start with. Thankfully, I had a good paying job. My CEO and my co-founder Ken, he's a very successful serial entrepreneur. He had a software company that was just acquired by a big firm, and so we were able to finance that the kickoff, like you said, finding law firms that to actually start the company and create the Inc. You know, finding the lawyers to start negotiating with the University of Bern for the core technology. You know, finding a core lab to start collecting data. We didn't even talk about data, and that's a huge issue when you're developing AI algorithms. So all that initial cost is we kind of funded that, and then we started raising angel investor funds through basically angel investors are basically family and friends, right? That's any startup usually that's the first pool that you tap in of family of friends and who would be interested in early investment in your company. Those are people who really believe in you more than they maybe believe in the technology, or maybe they don't have a deep background in the technology. But you are at a certain level where you can demonstrate that you have a plan, and you have confidence that your plan is going to succeed. And then once you have the next level is finding institutional money or grants. And you can start with grants if you're starting within an academic center. However, we did it. So the next level for us was finding institutional money. Finding institutional money is more challenging, and you have to demonstrate a lot more data points in your plan than what you have to show to angel investors. So you have to have data on a lot of data on the performance of your algorithm. And you might even have to have an FDA clearance to be able to raise such funds, because especially for VC companies, they might not be really interested in investing unless you actually have a product that you are commercializing, and you can demonstrate sales. Otherwise, they will not invest in your company. Yeah, so it is very tricky. We're going in all directions. Because we want to move fast. So we're
Right.
actually doing a lot of investment or money raising in parallel. We're
Right.
approaching angel investors, family and friends. We're approaching, family offices, which are like a small seed funds offices. We are also approaching VC companies. There are, for example, you introduced us to this Octane group in South California, which were very helpful for us in honing and making it very clear what is our investor pitch is, because what investors want to hear it's usually different than what physicians want to hear, for example, about the company. It's a whole different paradigm shift there. So so that was a very, very helpful exercise to be able to come. It takes a long time to really prepare a well put together investor pitch with all the data points that the investor want to see, and you need input from investors on how to do this properly. And this Octane process was very helpful in that regard.
Right. Yeah, for those in the audience that are interested, it's at octaneoc.org. It's a ecosystem in Southern California in Orange County that focuses on med tech, medical device, biopharma, that kind of stuff. And they have a lot of free resources. And there are many, many of these ecosystems around the country. You don't necessarily have to do that one. They're all over the place. They're in Denver, they're in LA, they're in San Francisco. But so that's a good resource to look at. Another question is, given the provenance of this company, why did you decide to get FDA clearance versus European clearance, or did you?
No, so the European clearance, we have that planned after the FDA clearance. Of course, because we are a US-based company, and talking a little bit about data, you have to have representative data of the population in the training phase, that to the population that you're actually going to use the medical device on. And most of our data came from US hospitals. So so an FDA clearance was the more direct and straightforward approach to go. After that, we will turn our attention to the CE mark, or the European clearance for the algorithm.
So this is an interesting issue because in traditional clinical trials, there's a lot of decisions that go into where do you do the trial. Do you do it in the US? Do you do it in an outsourced CRO? Where are they going to do it? What are the tax benefits or financial issues? For example, if you do it in Australia, is the data usable for the FDA to make the FDA approval process easier? But we're talking about real patients. They're like a drug for a disease, but now we're talking about data. And so the issue is, are the rules the same for patients as they are for patient data? And that gets to the issue of the challenge of getting enough data you can use to inform the algorithm. So can you kind of walk us through, you've mentioned this before, and it's a big problem for anyone developing an algorithm. Where do you get clean data?
Yeah, so issues regarding data might be the Achilles heel for a lot of development of medical AI softwares. And yes, so there are issues related to data that are very important. Okay, first of all, what data, right? And then where to get the data, and then how much data, and then how are you going to clean the data, right? Prepare it for actual AI development. I'm just going to talk about our experience. We were lucky for the fact that there are a lot of publicly available good quality data who haven't expired, because data have shelf life expiration, especially imaging data, because of the development and the improvement in imaging technology. So, using data from 20 years ago to develop an AI algorithm today is probably not going to be valid. So you also need to find recent data. So we got lucky that there are a lot of publicly available data banks on the TCIA website for patients of high-grade glioma. And we used this data, a lot of this data in our development, in addition to some privately obtained data from a few medical sites in the US that are our preclinical sites and collaborators. So this is where we got the data from. And then getting the data is just one step. The next step, the next huge step that is really time consuming, a lot more than actually having the data, is curating the data, cleaning the data, developing the ground truth for training the algorithm. And we had 6 radiologists, including myself, working on developing the ground truth for this data. And it took close to 8 months to develop enough data to train this algorithm. So yeah, it was very challenging. If there's someone out there who is trying to develop an AI algorithm and they don't have a publicly available data, then they're going to have to think about the cost involved in purchasing this data from medical sites, because medical sites now, they realize the importance and the value of the data in the AI era, and they will charge you for this data. They're not just going to give it to you, and if they're just going to give it to you, they're going to ask you for a piece of the pie.